The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to SCNM's webinar. We're very excited to bring you this interactive online experience that will let you learn more about careers in naturopathic medicine and share with you examples of alumni practicing out in the field. My name is Jody Durham, and I will be your host for today's webinar. Before we begin, let me take a moment to familiarize you with this simple technology and your control panel. You will need this tool in order to actively participate in our webinar. First, let's make sure that your control panel is expanded. There should be a box like the one shown in the upper right-hand corner of your screen. If you do not see this box, look for a double arrow. Click on these arrows and your box will expand. Second, let's make sure that you can see my desktop, which currently shows an image of a webinar control panel. This is the window you will use to view today's presentations. You do have the opportunity to ask questions. To do so, if you would, just type your questions into the box indicated here. Your questions will then be answered verbally. Questions will be answered after the presentation is complete. We do anticipate this webinar to run approximately 60 minutes, 40 minutes of presentation, and 20 minutes following the presentation to answer any questions. Let me give you a brief introduction to naturopathic medicine. An ND concentrates on whole patient wellness, attempting to find the underlying cause of the patient's condition rather than focusing on symptomatic treatment. Naturopathic doctors utilizing natural therapies rather than synthetic drugs. Naturopathic doctors practice the 6 fundamental principles of naturopathic medicine. As you can see, first, do no harm, the healing power of nature, find the cause, doctor as teacher, treat the whole person, and preventative medicine. During this webinar, you will be hearing from Joanna Hagan, SCNM's Career Services Director. Joanna Hagan has been the Director of Career Services for Southwest College of Naturopathic Medicine for 13 years. In her position, she offers students and alumni guidance, advice, and assistance on all things career-related, from job placement and CV development to market data. The Career Services Department also assists graduates in finding positions, building a practice, making connections, and advancing careers as NDs. Joanna has 30 years of healthcare marketing and finance management experience derived from the insurance HMO world and has assisted hundreds of physicians in building their practices by judicial use of marketing through networks, and simultaneously created her own coaching business in 1997. She has focused on assisting the naturopathic medical field grow since 1998, concentrating most of her efforts to increase the success of naturopathic physicians. Her passion and mission in life is to change the healthcare system in the U.S. so it is more effective and efficient. So once again, thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce our presenter. Joanna Hagan.
Well, welcome everyone. We're having a slightly cloudy day, a rare event for Arizona, and we're very glad that it is because we're looking forward to some rain. Well, I'm so excited to be able to present to you the naturopathic careers, compensations, and opportunities. This graph shows the robust economic environment into which you will be graduating. The use of natural medicine has been steadily increasing throughout the decades. As you can see by this National Health Studies, a division of the CDC chart, the use of natural medicine has increased from 13 billion to to 34 billion, over doubling in 17 years and increasing by 26% in the last 10. The demographics of natural medicine use were documented by the National Health Studies, a division of the CDC, in 2002 and 2007. Its use is documented by the age groups. You can see that the average age, or the average United States population, about 40% is using some version of naturopathic medicine. People between the ages of 25 and 45 are desiring to raise their children in an organic, non-toxic, healthy, natural world. And what better place, as you can see by this chart, than to take them to a naturopathic physician for their health care. This increase is being corroborated in the marketplace as the most numerous requests for naturopathic physician is for the family medicine and pediatrics. Other items to notice on this chart is the slide for the people over the age of 70. These people are paying cash from their limited resources for this medicine, as this is not currently covered under Medicare, because the clinical results it gets for them is greater than the traditional medicine. At this time, the profession is working very hard at getting Medicare to cover these services. It's just a matter of time before that happens. This slide talks about the growth of state licensure. This is how licensure has grown over time. You can practice naturopathic medicine in almost every state in the U.S. Each state in the U.S. determines what a naturopathic doctor can do. Licensed states usually have a broader scope. These are the items in blue. The broadest scope of practice in the United States is Arizona, yet there are other states which are very close to it, such as Vermont, New Hampshire, and Washington, D.C. In an unlicensed state, you can do lifestyle counseling, botanical medicine, homeopathy, nutrition, and order naturopathic tests. Most people are unaware that at one time, almost all of the states in the United States was licensed for naturopathic medicine. But at this time, we are in the process of resurrecting those licenses because the profession nearly went out in the late 40s. Naturopathic medicine by the numbers. The highest concentration of naturopathic physicians is on the West Coast in Arizona. Arizona has the second largest concentration of all NDs in the country. 75% practice in licensed states, 59% earn $60,000 or more in those states, 25% practice in unlicensed states, and 47% earn $60,000 or more per year. But oddly enough, our highest income earners within the profession come from unlicensed states. Oh, what you can do as an ND. When you become a naturopathic physician, you are going to learn nutrition. So you can be a nutritionist. You're going to learn how to tap into a patient's motives and help them change their lives. So you're going to be a lifestyle coach. Because you're going to be taking your courses in Arizona, you will wind up being 2/3 to half of an acupuncturist. And the reason I say that is because in the state of Arizona, you do not need an additional license in order to practice acupuncture. Whatever courses you take at SCNM will qualify you to practice acupuncture without an extra license. However, if you decide to leave the state and practice elsewhere, the state that you will practice will determine what courses you have to take in acupuncture in order to get your licensed acupuncturist designation. And then you're going to learn everything an MD learns. You are going to be able to prescribe drugs, order lab tests, do minor surgery, deliver babies, sign birth and death certificates, IVs, injection therapy, stem cell therapy. It's amazing to see how large your toolbox will be. You are going to also learn naturopathic manipulation, which is similar to chiropractic, but not exactly the same. You'll also learn herbs, and we call those botanicals, so you'll be an herbalist. You'll also learn homeopathy, so now you're going to be a homeopathic practitioner. You're going to learn hydrotherapy and many more modalities not mentioned on this slide. Now, up until now, we have been talking about general practice naturopathic practices, but I'm here to say that you can also have a focused practice or an area of concentration. You could concentrate your practice on women's health, sports medicine, men's health, counseling, emotional, cardiology, pediatrics, oncology, aesthetics, environmental medicine, ADD, ADHD, pain relief, weight loss, and whatever it is you decide. And here are some examples of our SCNM alumni who have done just that. We have Dr. Jennifer Nevels and Dr. Seema Adoon, and they have created a focused practice on women's health. And then we have Dr. Matt Caviola and Dr. Jean-Luc Le-Provost, and they have focused on men's health. And then we have Dr. Jordan Hoffman and Dr. Jason Barker, and they have focused their practices on sports medicine. We have Dr. June Stevens and Dr. Decker Weiss, and they have focused their practices on cardiology. And in particular, Dr. June Stevens has focused a furthermore, and she works mostly with women in cardiology situations. Then we have pediatrics. We have Dr. Jamie Oskin and Dr. Jessica Mitchell. And for oncology, we have Dr. Lucas Timms, who works at Cancer Treatment Centers of America, and Dr. Dan Rubin, who is the co-founder of this particular designation, which stands for Fellow American Board of Naturopathic Oncologists. This is one of the true specialties within the profession. You can become a specialist. It takes additional coursework after medical school, and you have to take an exam and be accepted by your peers. So Dr. Dan Rubin is a naturopathic oncologist, and he co-founded that particular society. And then we have Dr. April Darley and Dr. Sunil Jain, who focuses their practices on aesthetics. And we have Dr. Dave Arneson, who works with environmental medicine. He just recently received the Alumni Award for Community Outreach, and the fact that he works with drug-addicted people, and he has come up with a protocol that allows people to come off of drugs, detoxify, so to speak, without the symptoms of withdrawal. And then we have Dr. Carol Carroll, who is also a psychologist and combines her naturopathic expertise with her psychological counseling. And then we have Dr. Crystal Tellier, who works with children and ADD and ADHD. For pain relief, we have Dr. Jason McNeil and Dr. Rob Berg. And for weight loss, we have Dr. Brendan McCarthy and Dr. Lisa Maturo. Now, I'm also here to say that up until now, we have been talking about clinicians, and about 90% of our grads are clinicians, but it is not all that you can do with this degree. You can be a researcher, you can work for a nutraceutical company and develop natural products, or work as a medical educator. You can work in media and medical communications, be on TV, write books, be a spokesperson for a nutraceutical company. You can work in public health. It is highly recommended that you would get a master's in public health in addition to your naturopathic degree so that you can work within the agencies, and also they can hire you as a consultant. You can also do global public health and academia. And as you just learned earlier, one of the naturopathic principles is docere, which stands for to teach. And many of our naturopathic physicians love to teach. And so they teach in colleges or universities or community college, online college, allied health schools on a variety of topics such as basic sciences, anatomy, physiology, chemistry, alternative medicine overviews, or health. And it's important for you to know that when you graduate with your degree, you will have an equivalent of a doctorate, which will allow you to teach almost anywhere in the world. So here's some of our alumni examples that are doing research. Dr. Denise Warden works with different enzyme nutraceutical companies doing double-blind placebo testing. And Dr. Alan Christensen, as a result of his thyroid research, which was paid by a thyroid company, he also wrote a book, so he gets income from that too. And then you have Dr. Christy Anderson. She was hired as a medical educator for HEAL. And in natural products and nutraceuticals, you can also develop and create private labeling, your own formulas. You can be a medical educator, as Christy Anderson is, or you can be a product developer. In media medical communications, Dr. Denise Warden pops up again. She was offered a PBS special on comparing alternative medicine to allopathic medicine. And here's some more media stars. We have SENM alumni authors, Annalie Ely, Alan Christensen, John Robinson, Kurt Tyson, Tina Mercantile, Rob Streisfeld, Andrea Purcell. And here's our true media star, Dr. Holly Lucille. Dr. Holly Lucille is an author. She's been featured numerous times on Lifetime Television for Women and Discovery Health Channel. She's been a guest on a number of radio and TV shows, and she was listed in 2007 as one of the top 100 influential people by Time magazine. And she just recently appeared on the Dr. Oz show. And what makes her special is that she is probably the first naturopathic physician awarded her very own cable TV which is being aired in the Los Angeles marketplace, called The Myth-Defying Dr. Holly. If you're interested in global health, public health, we have Dr. Sean Hessler. And Dr. Hessler is the founder of Naturopaths Without Borders. And this is an organization that travels around the world and establishes clinics in indigent countries that have no health care. If you're interested in working with an agency, again, we recommend you to get a Master's of Public Health. And our last one is Dr. Sabine Garrett. She is actually a full-time teacher at Grand Canyon University. She's an associate professor and teaches biomedicine, but she also has a private practice on the side. So if you want to become a full-time teacher, you can do that too. What do MDs do? Well, these are the types of employment settings as measured by the American Association for the Naturopathic Physicians. That's our national association in 2012. So these are the kinds of things where naturopathists find themselves working. They find themselves working in a hospital and other settings, and the hospitals they're referring to are not the typical hospital. They're referring mostly to Cancer Treatment Centers of America, which is the #1 employer outside of naturopathic colleges of naturopathic physicians. Also, this is where the nutraceutical people are lumped, as well as research. Then we have naturopathic physicians working in groups of other practitioners, whether they be naturopathic physicians or other types of practitioners. And then the majority, 42%, are naturopathic physicians with their own practices, seeing patients on a daily basis. And then we have the naturopathic colleges, which make up 5% of the different types of employment settings. And then we have ND incomes varying according to employment settings. The hospital and others, this is nutraceuticals and the CTCA people, as well as research. Now, the hospital and the nutraceuticals are the highest paying, which is kind of what's making that up to $120,000. Nutraceutical companies pay very well, as well as CTCA and hospitals. Then we have groups of practitioners. People who work in groups actually seem to make more money than people who work solo. And there's a reason for that, because they're sharing expenses with other practitioners and not bearing the full brunt. And that's 27%. And then we have people in solo practice, which is 42%. They're making about $75,000 to $78,000. And then we have the ND colleges, which seems to be coming in at $55,000, and that's 7%. And now we have naturopathic incomes, comparing that to the number of patients seen per week. Now, it makes sense that the more patients that you see per week, the more money you'll make. So here's 1 to 20, and that's patients per week, that's 60,000. This is 85,000 is 20 to 30. 31 to 40 patients is 120,000. And then 41 to 50 is about 42 to 43,000, and 51 and over is about 157, 58,000. So once you get over 40 patients a week, there's not much more return. Income by years of practice. So the 2012 survey from the American Association of Naturopathic Physicians started at 5 years. So 5 years or less, they're averaging $60,000. 6 to 12 years, they're averaging about $100,000. 13 to 20 is $118,000, and 20 and over is $120,000. Now, I further drilled down that first 5-year period because I get a lot of questions about first year, second year, and third year. So let's go over that. The first column shows early practices, and that's averaging around $35,000. Now, that's usually your first year, and it's dominated by residencies. We'll talk about residency in a minute. But early practices average $35,000 because what you need to understand is that you are building a practice, and that takes time for you to build that practice. So this is a mature practice. They're showing it at $90,000. Now, according to the AANP, it takes about 5 to 6 years, as we saw in the previous slide, to get up to about $100,000, $90,000. But I'm here to say that people beat that record all the time. And I've actually seen one alumnus do this whole thing in 1 year. But keep in mind, he worked 60 and 70 hours per week in order to do that. So again, the number of hours you work and how hard you work determines how much money you make. And not only are our naturopathic physicians doing well financially, they also love their work. This particular survey was taken in 2004, but yet it was corroborated again with the American Association of Naturopathic Physicians 2012. 78% of the doctors surveyed that not only were they satisfied with their career, they loved what they did. They absolutely loved it. And what they found was the longer they practiced and saw patients, the more they loved what they were doing. And here are some of our quotes from our alumni that are expressing just that feeling. This is from Dr. Yolanda Rodriguez. I humbly enjoy helping people change their lives and watching them blossom into their best health possible. Or this is Drs. Fuji and Drs. Heath. Each day is different depending upon who walks through our doors. Every day is rewarding when you are making a difference in people's lives. Well, here's another one. This is Dr. Sean Hessler and his wife, Dr. Sarah Preston. We feel so fortunate to share naturopathic medicine with those in need. We enjoy our close relationships with patients and walking beside them in their journey to good health. Now, what does the Career Center do for you? Well, one of our most important things is we provide a concentrated source of naturopathic opportunity postings. Oh, that's not it. Yeah. Well, we thought we had a link for you to show, and it worked in our practice, but it's not working now. So I'm recommending that all of you access www.ndjoblink.com. Now, this is a new innovation of SCNM's that came out in July of this summer. And what it is a collection of all the naturopathic opportunities in North America, and it is posted in one place. So if you want to see the robustness and the diversity of what's available to you in naturopathic medicine, that is a great resource for you to go. Now, keep in mind that in the real world, that particular link only shows 20% of all of the opportunities that really do exist within this profession. It's like literally the tip of the iceberg. So when you're looking at that website, what you need to know is that's only 20% of what's out there for you. The rest of it is never, ever advertised, and it is only through referral and your networks in which you would ever get offered that position. The next item is statistics of the profession, and we just saw that. And all of that information is available to you, and if you need more, I have more. And then also, what the Career Center does is we assist in curriculum vitae preparation and cover letter preparation. Now, a lot of questions I get is, what is a CV? What does that stand for? Well, first of all, a CV is what physicians use when they apply for positions with other doctors. A CV stands for curriculum vitae, and it's a much more professional way of presenting yourself to another physician. So we want to make sure that you present yourself in the most professional manner to any physician that you could possibly be working with. In addition to that, we also have naturopathic residencies. Now, I mentioned earlier, we do have residencies. It is not required for you to have a residency in order to practice after you graduate. However, it is highly recommended. There are approximately 60 residencies for about maybe 500 to 600 naturopathic graduates throughout North America. So needless to say, the competition for those 60 residencies is steep, and therefore not everybody gets an opportunity to do that, a residency. So it's just like applying to post-medical school. You have interviews, you have essays, transcripts, and the whole shooting match. And what our Career Center does is we help prepare you for that. And right now, when people work with the Career Center at SCNM, about 92% of everybody that works with us winds up with a residency. And then we have career development seminars. Every Wednesday, soon to be Tuesday of next year, we have successful alumni or people who have used their degree in a unique manner, or if there's another way to make money, we will show you how to do that. And that's just about every single week while you're in school, and you can attend for an hour and get additional information on how you can make this degree work for yourself. Network opportunities. The vast majority of your opportunities do not lie within the college. They lie outside of the college with other doctors. We encourage you to attend outside conferences where you will learn something and also meet other naturopathic doctors and other doctors who are very interested in what you're learning. What's important for you to know is that right now today I'm helping you figure out and design your naturopathic career. As a prospective student, you have the resources of the Career Center. You have the resources of the Career Center all through your 4 years of students, and I also work with alumni to better position themselves to create the naturopathic career that they want. So this is a lifelong benefit. If you need to get a hold of me, here is my number and my email. I'd be more than glad to chat with you. And at this point, I will pass control over to Jody Durham.
Thank you, Joanna. We'll now open up the floor for questions, as well as address those questions that were submitted beforehand via our website. You can always request information from me at j.durham@scnm.edu. So let me go to my question board and see what questions we have out there. All right, Joanna, so I'm going to ask you the questions, and then you can respond to the students. Okay, incomes shown, are these recent grads or NDs over time? Also, how does this compare to MD income? This is from Jim.
Jim, I think later on in the PowerPoint we talked about that. So basically the incomes that you're seeing are from people who've been out there over a period of time, and it shows the income varying by the number of years practicing. And then the recent one, I have that slide that talks about the $35,000 for the first year, and then taking 5 to 6 years to become a mature practice. But in reality, I see that happening in about 2 to 3, depending upon you know, where the student is and what kind of work they actually did to set themselves up prior to graduation. There's a huge, huge relationship to that, and I hope that answers your question.
This question comes from James. Is there a particular practice that tends to have higher incomes, such as endocrinology, oncology, etc.?
Oh, that's a great question. You can have high incomes really using any kind of practice. Matter of fact, we just had an alumnus, Dr. Phil Wozni, who mentioned in his first year of opening his practice, now he had been out about 6 years prior to, but his first year he booked $500,000, and he's just a family practitioner focusing on pediatrics. Remember I told you that's a hot topic. A lot of people really want to raise their children healthy and non-toxic, so I would say that's a hot one. Obviously, oncology, when you have a life-threatening disease, people are willing to open up their wallet and do whatever it takes. Any kind of chronic disease that has not responded to traditional health care would be another field, so that could also be endocrinology. I mean, from a profit point of view, one of the things I find is that IVs, procedures, and acupuncture definitely have higher profit margins. So if you're doing any of those modalities, you certainly have an opportunity to make more money per hour. I don't know if that answers your question, but.
Thank you, Joanna. The next question I have is from Anna. How successful are your graduates paying off their student loans?
Well, our recent stats show 99.9% of our graduates are paying off their loans. So there you go.
Perfect. I have a question from Asia, I believe. You mentioned NDs are not covered by Medicare, but do any insurance companies cover ND services?
Absolutely. Again, this is state-driven. If you were to live in the states of Alaska, Washington, Oregon, Montana, Vermont, New Hampshire, Connecticut, all of those states allow naturopathic physicians to be on insurance panels. In some cases, you would also even be on an HMO if you so chose. So it isn't so much, you know, whether or not insurance covers you, it's so much where you're practicing. In the state of Arizona, we are covered by insurance plans. It's just the out-of-network plan. We're not ever in-network. And that changes from time to time, so every state is different.
So this comes from Jim, Anna. You mentioned only 60th residencies for about 500 graduates nationwide, but over 90% of SCNM get residencies. He's asking, did he hear this correctly?
No. 92% of the people that work with the Career Center wind up getting residencies. Not all of our students work with the Career Center. And those that do generally get one. Those that don't, it's a 50-50 chance. So bottom line, if you want to work, if you want to get a residency, work with the Career Center, and we'll show you how to do it from day one, and then you'll have a much better shot of getting in. So, and just so that you know, 15% of our alumni wind up in residencies. I think that's kind of what he's asking.
Perfect. From Callie, I saw a webinar last month of FCNMs that talked about NDs being able to actually prescribe prevention and wellness methods. Where can I learn more about what NDs can legally say on the media and prescribe within that field?
Well, I know that there's a document at the American Association of Naturopathic Physicians, the AANP, that shows by state the very specifics of what a naturopathic physician can prescribe. So I would tell you to go directly to them at www.naturopathic.org and ask for, I want to say Steve Jaffe, I believe, yeah, I think that's his name. And he should have a handout where you could look and see all they usually prescribe by schedule or formulary. I hope that helps.
Another question from Jim. Oh, sorry, I just lost it. How will the new Affordable Care Act help NDs?
Well, we anticipated this question, and we have, and for the life of me, I just forgot the name of it. SB 207, I think. And basically, it's a part of the bill that prohibits any state, any doctor, or any entity from discriminating against naturopathic medicine for any kind of networks or insurance coverage. So that's the good news, that we cannot be discriminated. The other side of it is that from a prevention point of view, we are gathering data, and that's our biggest challenge right now, is gathering enough data from all the naturopathic physicians in the United States to prove to the heads of insurance companies, to the heads of federal agencies, that naturopathic medicine actually saves healthcare dollars because people get well and they stop getting sick. And the sooner we can prove that, the faster they're going to sign on, because the minute they realize that they can save money by using naturopathic medicine, they will. And we're very excited about that, and I think it's just simply a matter of time.
I have a question from Jacob. Is there a website or contact information to someone that will let us know what our state's regulations are, especially regarding licensure to also practice acupuncture?
Well, I have a thumbnail summary of every state in the nation I'd be more than glad to send you. But if you really want to drill down in terms of what state can do what, then I would recommend you to approach the president of your local state association for naturopathic medicine, whoever that person might be, and or the state authorizing board. Those are probably the two best. What I have is a simple summary, but if you really need to get down to the nitty-gritty and drill down and get the specifics, those would be the two places you would go.
Also, from Steve, I'm a Canadian citizen. Will I be able to obtain a visa or green card to undertake a residency or start a practice upon graduation?
That's a very good question. It depends on the residency, and the owner of the practice will be the person that makes that business decision. So we have had, on occasion, people from Canada get green cards. But again, it just depends on how much they want you and whether or not they're willing to go through all the hoops to get that.
All right, we have a couple more on here, but it looks like they're for actually me. Crystal, you had asked, is there a place I can find those states? I'm thinking, Joanna, Crystal is asking if there's a place she can find which states are licensed and which states are not. So that's the AANP.
Yeah, I would go to the AANP www.naturopathic.org. And also I have that handout.
Right. On the income question, you didn't touch on how this compares to MD income. That's from Jim.
Yeah. I can't really comment on that. I can tell you that it's probably on a par with pediatrics, the lowest paid ones. Because we don't have access to Medicare and Medicaid, we don't get paid for a lot of those things. So it is not the same. But I would say it's equal to a pediatrics or a general family practitioner.
Okay. Are there any naturopaths working in oral medicine, or is this forthcoming? That's from Darlene.
Ooh. I know of alternative dentistry, but I got to be honest, I have not heard of anybody doing a naturopathic dentistry. So I'm sorry, I wish I did.
Some of these questions are for me, so I'm just kind of see. From James, I recall reading that Arizona MDs are now able to prescribe cannabis to patients in need of this treatment. Are MDs able to prescribe this form of treatment as well?
Yes.
Just bear with me, everybody. I'm just trying to figure out which one of these questions are for me in admissions. Okay, I'm going to go ahead and switch my PowerPoint over to the admissions requirements. And if any more comes in for Joanna, Joanna is still here, so we can definitely ask her as well. But in the meantime, I'm going to go over admissions requirements to SCNM. We do require a 4-year bachelor's degree and the completion of the prerequisite coursework, such as 12 semester credits of biology with labs. It has to be at a science major level, 3 semester credits of organic chemistry with lab for science majors, and 3 semester credits of biochemistry. Or in place of biochemistry, you can always have organic chemistry too. So, but make sure that one of those, either organic chemistry 1 or organic chemistry 2 has a lab. I just need one of those. 6 semester credits of humanities, 6 semester credits of psychology. Most students come in with Psychology 101 or Intro to Psychology, which is fine. But we do ask that the second psychology is a developmental psychology, such as adolescent behavior, animal behavior, anything dealing with behavior. And then 6 semester credits of English. SCNM application is through NVCAS. which is Naturopathic Doctor Centralized Application Service. So we do have an online application service. Letters of recommendation are required. The essay is required. Transcripts from all colleges attended. Even if your transcript, say for instance you took basket weaving, and that's not one of the requirements of SCNM, you still need that transcript. So we do, NDCAS does need every transcript. At that time, once NDCAS receives your application and accepts it, your admissions rep will look over everything and determine if you are awarded an interview, and then the interview is here on campus. So that's going to be the admissions requirement. So I'm going to go back to my questions because I know I had quite a few questions for admissions. Caitlin asked when are good times to do campus visits. Actually, anytime you can do campus visits. There's 3 reps here at SCNM. Just feel free to give us a call and let us know that you've never been here before, or even if you have been here before. Please come and visit. You can also able to do Student for a Day, which consists of shadowing in a classroom for most of the morning, and then talking to career services one-on-one and financial aid one-on-one, and then you're able to go to the medical center and possibly observe. And I say possibly because it's all going to depend on the patient flow that the doctor has as well as the patient themselves. So the majority of the time our prospective students are able to shadow, but sometimes, that runs into a problem. But if you don't get to shadow the first time you come, second time, hopefully you will. So just keep in mind that this clinic is a teaching clinic for our students. Maya asked, I had a hard time finding information about tuition. Tuition here at SCNM, Maya, is $28,000. And then, of course, that's strictly tuition. That's not including books, and that is not including any living expenses. Let's see, Steve, can you please speak to whether or not you have any number of students coming to SCNM as second careers? Absolutely. We have students that come in right out of undergrad and is ready to go, and we have students that have been out of school for 20 years. Maybe this is a time in their life that possibly their kids are grown, and it's a time in their life that they can pursue their dream or their passion that they've had on naturopathic medicine. We do about, I would say probably, I don't know, this could be high, but I'm thinking maybe 30–40% of our students come in as a older student. So, but yes, definitely, Steve, that's definitely, we bring in undergrad students as well as second career. The credit, let's see, Debbie asked, what is the credit hour cost? It's $293 a credit hour. And are there any family discounts offered? Not that I know of, Debbie. Let's see, Debbie asked, if you are already in a clinical nutrition program at another regionally accredited naturopathic school, is it possible to transfer those credits? And also, what are the requirements of prereqs? I already went over the prereqs, and can they be done online? The prerequisites can be done online, yes. SCNM never, at one time, we wouldn't let prerequisites be done online, but to be competitive with the healthcare world, yes, our prerequisites are able to be done online. And as far as transferring from another accredited school, absolutely. We get students from the different accredited naturopathic schools, at least 1 or 2 every incoming class. So what you would need to do is you would need to get us your transcripts so that we can verify that the prerequisites are met, which I'm sure they are, as well as syllabi. You will need syllabi from that naturopathic school that you are attending so that we can see what you have taken. Let's see. How long, Safaria asked, how long does it usually take to get accepted into SCNM after graduating from college? Again, you'll want to go through the application process. Once you are invited to the school for an interview, the interviews are always on certain Fridays of the month. and then you interview on Friday. The following Monday, you find out if you've been accepted or not. Where can I see more about scholarship info? That was Callie. Scholarship info is available through SCNM for incoming students. That's one of the scholarships that you can qualify for. For those, there's nothing that an incoming student needs to do. Your admissions rep actually puts you in the hat or the pot for the scholarship committee, and then they decide based on GPA if you qualify for a scholarship. Other than that, you can contact Anna Borjas, who is our financial aid director, and she's at a.borjas, and that's B as in boy, O-R-J-A-S, at scnm.edu. She is our financial aid administrator, and she would be able to let you know how to apply for outside scholarships. And Joanna, you said 99% of students are paying back their loans. What is the time period this is based on, and how long after graduation are you tracking these students?
I think it's 10 years.
Okay.
It's 10 years, and that's how long we're tracking it, 10 years.
Perfect, thank you. If one is licensed in one state, can one license in another state with that license? That came from Carol.
When you want to transfer, well, the first question is, do you want to mutually hold two licenses simultaneously from state A and B, or do you want to take the license from state A and transfer it to state B? If you want to do the second situation where you're transferring from state A to state B, that's called reciprocity, and that's determined by the state. Most states in the United States honor other licenses from other states, but not all do. California, you would have to reapply and start from scratch. You don't have to take the board exams again, but you would just have to reapply as if you were a first-time person. So in answer to your questions, mostly yes, but sometimes no.
Okay, great. I'm going to have you sit right there, Joanna, because there's another one here for you. Do students tend to work, no, I'm sorry, this is me. Do students tend to work part-time during school, or do they primarily rely on loans for living expenses? That's from James. Honestly, James, about 99% of our students rely on loans. The way our curriculum is set up is each quarter our students are taking anywhere from 27 to 29 credits a quarter, which I'm sure you can tell is extremely intense. Some of our students do work, and I would never tell a student that they could not work. However, I do educate them that it is very difficult to do so, and I would recommend that they wait till at least they are through maybe quarter 1, quarter 2, and quarter 3 to get an idea of how do they study. What's their niche? How much time do they need to study? You can't really tell that if you're working also. So I'm not telling you can't work, but some students do, some students do not. But it is difficult, definitely. But the financial aid is available. Let's see. Michael, if a bachelor's degree is more than 7 years, do you still need to see that transcript or only the current courses? No, Michael, we need to see every transcript, whatever, any undergrad or any schooling you did after high school, whether it's a community college, a tech school, an undergrad school, we need to see every transcript. Or let me say, NDCAS needs to see every transcript, as well as you will need to list every coursework that you did throughout your lifetime. Jennifer asked, what would be equivalent for credits, say 6 credits of biology? 6 credits of biology, our credit system here for our science prerequisites is 4 credits per class. So it's 3 credits for the lecture and 1 credit for the lab. So when I say we need 12 semester credits of biology, that's a total of 3 classes. So and what you can do, Jennifer, is whatever classes you're taking, you can always send your transcripts through WES, which is World Educational Services. They are a third-party servicing company that we use to view foreign transcripts. And they can determine, they can take the transcripts that you took in Canada and convert them into U.S. credits and let us know if they are equivalent. All right. Darlene asks, is there a statute of limitation for prerequisites? How old is too old for them to be accepted? We do have the 7-year rule. The 7-year rule, but it's on a case-by-case basis. Say, for instance, that you've been out of school 7 years ago, but you are pharmacy tech. So you're currently in the medical field. So in a case like that, I would submit your resume as well as your prerequisite evaluation that we do for you to our basic science board and have them determine if you need refresher courses or not. Sometimes students are required to take refresher courses, sometimes they are not. It depends on what you're currently doing and how old the prerequisites are. I do ask the students, my students that I advise, that if your sciences are over 7 years old and you are not currently in the medical field, I ask that you do take at least 1 biology and 1 chemistry as a refresher course, and you can take both of them together. Let's see. Stephen asked a great question, and I wanted to bring this up, and I forgot. I was curious if this webinar presentation will be recorded to view for future references. Absolutely. All of our webinars are recorded and put into an archive file on our website. So you can go to our website, and you can view Dr. Mittman's presentation that he did last month, or another presentation that maybe was done 6 months ago. Those are all recorded. And unfortunately, I ran out of time for I had a couple more questions. If I did not answer your question, please send it directly to me and at j.durham@scnm.edu. So at this time, I do want to let you know also that we are still accepting applications for our winter class. We have a few spots still available for winter, which is January, as well as we're accepting applications for our fall class. I do have 3 more interview dates available for our January class if you're interested in getting in. Classes start, orientation starts January 2nd, and like I said, I have 3 more interview dates in December if you're interested at all. If I didn't answer your question, please email it directly to me, and I will email you back an answer. So on behalf of SCNM, I would like to again thank Joanna for your participation today, and to each of you for joining us today. We do hope that you found today's webinar informative and helpful. This now concludes our webinar, and I do want to mention that our next webinar will be in early December with our president, Dr. Mittman. Please check our website to register. I hope to see you then.